Hi.
Hi, my name's Diana and I'm your nurse today. I'm going to be taking care of Nathan here. Can you tell me a little bit about what's going on with him?
We were at the park and a fella had a couple dogs and Nathan loves the dogs, so he went over and started petting them, and just a little while after that his asthma kicked in. So
Goodness, I see here that we've already put some oxygen on him. His oxygenation, I was told, was 88% on room air. So we got him on 2 liters with humidified air. I'm going to just monitor this and make sure that's working for him. So I can actually hear him wheezing while he's breathing in and when he's breathing out
Right.
there. And so this tells me he's in an emergency episode. So here is a picture of what's going on with Nathan's asthma. If you look at the healthy one up here, we see that the lumen is nice and clear. And so there's enough room for air to go in and go out. Once Nathan starts coughing or meets up to one of his triggers, then all of a sudden we wind up in this second area here where the bronchus now starts creating mucus. This mucus winds up blocking the airway, making a smaller lumen and making it difficult for him to breathe.
So
And
it's
this is where the
constricted.
coughing, it is constricting, beginning to constrict a little bit, but not as bad as he is right now. A rescue inhaler at this point would benefit him. He would have taken it and then that would have settled that down for him. But today Nathan is here because he's having expiratory and inspiratory wheezing. That means that he's severely constricted. If you look at this last picture here, it shows the smooth muscle extremely constricted for him. And then over here, and then you add the mucus that's going on over here. So he now is really, really narrow, and so it's very, very difficult to get air in and get air out. Normally, they usually have trouble just getting air out. But Nathan here is in deep trouble. So what we're going to do is we're going to start him on a couple of medications. One of them is a steroid, methylprednisolone. The steroid is going to help decrease his inflammation that's going on in there and hopefully decrease him and get him back up here on this bronchus for us. And I'm going to give this through his IV.
Okay.
The second thing we're going to do is we're going to give him a bronchodilator. This is albuterol. So we open up our little nebulizer and we put some albuterol in there. And Nathan is going to inhale this for us. So he, go ahead.
What else can trigger, I mean, besides like the dogs obviously,
Right.
but what else can trigger his asthma?
Well, there's many things that can trigger it. It can be dust, it can be mold, mildew, even cockroaches. Sometimes it's grass pollens out there, tree pollen. Anything could trigger that. We need to send him to an allergist and find out what type of allergies he has so we can be ready with those triggers beforehand and know to keep him away from those. So he went to pet some dogs and we are going to figure that he's allergic to the dander on these dogs, and I'm going to have some very bad episodes with that.
Okay.
So we're going to also use a new system of keeping track of how to keep him out of the emergency room, and it'll let you know whether or not you should bring him to the emergency room. This is called a peak flow meter. And when Nathan starts feeling better, we're going to have him blow into this peak flow meter in and out for us, and we're going to set when he's feeling good. This is his good airway, good breathing here on the green. And our green says breathing is good. There's no cough, no wheezing. And he can go out and play and not have any issues at all, sleeps well at night, and so he doesn't need any medications at that point. But then say he goes to bed at night and all of a sudden you hear him coughing and having a little bit of trouble sleeping, maybe some chest tightness there, and you have him breathe through this peak flow and he winds up in the yellow area here. So at that point we want to give him what we call a rescue inhaler. And that's albuterol, the same thing he's getting through there except via an inhaler here that you can use at home.
Okay.
So he would take this, and the timing of this needs to be perfect. So he needs to take a deep breath and then inhale and push this down at the same time so that it can get all the way down to the bronchus there. If he can't get the timing of that, I can send a spacer home with him, and we will attach this spacer to this area here, and you can put the albuterol there. Then he just has to put his mouth around the hole here and then push one dose in there and then this inhale it from there.
Okay.
Okay? So we'll send one of those home too. But if this inhaler doesn't work for him, then we're going to have him, that means that he has blown into his peak flow meter, and now we have red, and we have more tightness and wheezing. We can hear the wheezing when he breathes in, the wheezing when he breathes out.
Which is where he is right now.
Which is where he is right now, and if you were to have him do that, he couldn't probably even get it as high as the red right now in there. This is an emergency situation. This is when this child needs to come to the emergency room and let us take care of him there. This is when that rescue inhaler didn't work for him. Do you have any other questions?
No, I think that about covers it.
Okay, so let's let him stay here for a little bit while, and then we'll send you home with all of this medication, and we'll see how he does. If he gets worse when he comes, when you take him home, then bring him back.
Excellent.
Okay?
Okay, thank you.
You're welcome.